Hello, my name is Ryan Cohen. I'll be presenting this work on behalf of the surgery department at Einstein Medical Center in Philadelphia, Predictors of Complicated Gallstone Disease during the COVID-19 pandemic. I have nothing to disclose. So the COVID-19 pandemic brought widespread challenges to the world of general surgery. Societal guidelines at the time, including SAGE's guidelines, recommended limiting surgery to imminently life-threatening situations. This resulted in lower operative volume for both elective and urgent cases. Laparoscopic cholecystectomies were certainly impacted by these guidelines. There were effects on outcomes, severity of disease, as well as hospital cost. Multiple studies have shown that patients presenting for non-elective lap choles were more likely to have complicated disease during the COVID-19 pandemic. Our clinical question was specifically what factors contributed to complicated gallstone disease during the pandemic. We performed a retrospective chart review from July 2019 to December 2020. We looked at all non-elective lap choles at our level 1 trauma center. We divided patients between the pre-pandemic phase and the intra-pandemic phase. We then compared uncomplicated cases to complicated cases. Finally, we performed a regression analysis to look for predictors of complicated gallbladder disease during each phase. Notably, we confirmed complicated gallstone disease in every case using histopathologic reports and descriptors. This chart is looking at all patients in both the pre- and intra-pandemic periods. In terms of complicated gallbladder disease, factors associated were advanced age, female gender, higher ASA class, being in the pandemic, complications, length of stay, and then total in-room time. Notably, total in-room time included both anesthesia time as well as the surgeon operating time. These are the results of our regression analysis. So in the intra-pandemic phase, and I think this is really the take-home, the two factors most predictive of complicated gallbladder disease were prolonged duration of symptoms and prolonged in-room time. In the pre-pandemic phase, we could not identify any specific predictors on our regression analysis. In terms of duration of symptoms, when comparing the intra-pandemic phase to the pre-pandemic phase, the duration of symptoms was essentially double, 2 days versus 1 day in the intra-pandemic phase. And the trend for in-room time was also significantly higher in the intra-pandemic phase. Based on these results, we conclude that patients may have presented later along the natural history of gallstone disease during the COVID-19 pandemic. This may have been exacerbated by prolonged in-room time, specifically anesthesia and intubation times. These factors, along a backdrop of surgeon fatigue, staffing shortages, and the systemic challenges of COVID, may have resulted in more cases of complicated gallbladder disease. Alternatively, complicated gallbladder disease may have put added pressure on an already strained system during the pandemic. Moreover, it's possible that complicated cases during the pandemic were quote-unquote more complicated. Patients were presenting later, disease severity was likely worse, leading to more challenging cases, and eventually leading to more prolonged in-room time, specifically operating time. Several factors may have contributed to increased duration of symptoms. Patients may have been more hesitant to present to the hospital during the pandemic. One study found that 41% of respondents to a survey stated that they avoided any medical care due to concerns about COVID-19. Financial hardship and access to medical care may have also played a role. 9% of U.S. households with anyone who had COVID-19 reported losing their health insurance during the pandemic. The many factors may have also contributed to longer in-room time, and these are through each phase. So in the pre-anesthesia phase, setting up the HEPA filters, staffing shortages, waiting for the COVID test results. In terms of anesthesia, PPE requirements, intubations were more complicated. We were minimizing the amount of people in the room during intubations. In terms of operating, again, there may have been more complicated disease. Surgeon fatigue and staffing shortages may have also played a role. And then in terms of extubation, kind of similar things, minimizing personnel in the room and staffing shortages. So in conclusion, complicated gallbladder disease was more common during the pandemic, and we think this was likely multifactorial, but delay may be the most important factor. This included delays in patient presentation, anesthesia care and intubation, and operative management. In the future, it's important to invest in advocacy to reduce patient hesitancy, to seek timely care, and pursue efforts to streamline nursing, anesthesia, and operative care in order to minimize that in-room time. Thank you.